GOLD participants from around the world. I'm Kristen Schwartz, licensed midwife and MC for GOLD Learning. I'm chatting today with Dr. Soo Downe about her upcoming presentation titled Any Color as Long as It is Rose Tinted, the Meaning of Informed Choice when Women Don't Have Access to Evidence-Based Care Provision. I'm so excited about this topic. It's a wonderful, very important topic, and we're so glad to have you here with us today, Sue. Welcome.
Thank you. It's lovely to be here. A great pleasure.
So, if you don't mind, tell us a little bit about yourself and how this became an area of interest for you.
Well, I'm a midwife by background, so I started training in the early 1980s to be a direct entrant midwife. I'm not actually nurse trained. And before that, I did a degree in literature and linguistics, and I was really amazed and shocked when I started doing midwifery to find out how little information women received about the kind of care they were getting at that point in maternity care, both antenatally and intrapartum. Over the next few years, certainly in the UK, there was a shift towards providing more information to women. But more recently, there's been a kind of a change in that process, in that the rhetoric has been around informed choice, but the actual provision of care hasn't really fitted with the rhetoric. So I was quite interested to explore this whole area, both over time and across countries, really.
Yes, and you brought up a very, very good point there when you're saying the rhetoric is there, and many care providers or even women each other tell each other to make an informed choice in their pregnancy and regarding pregnancy and birth. And without giving too much away of your presentation, can you shine a little light on what barriers you have encountered with this topic, when shining light on this topic?
The main one is that is the so-called menu, which is available in many countries or not available, in that choice seems to imply that women can choose anything, but in fact, in many countries, there's only a very narrow selection of things that are actually provided. And in some countries, if they make certain choices, they're actually criminalized. So that's probably one of the main areas that I think is worth having a look at and exploring in some detail. And then the other aspect is that, in fact, some women don't want to consciously, constantly be making choices, because actually what they want is a positive relationship with their caregiver, so there can be a kind of mutual trust between them. And having to constantly make choices is often quite stressful for women. So that's another aspect that I want to pick up. And there are others, but those are probably the main areas that I think are relevant.
That sounds very relevant, and it is so important for women to learn about what choices they have, and also for care providers, and how care providers and women can work better together as well. Looking at your presentation, what do you hope delegates will take away from it?
I hope what people will think about is that informed choice is often used as a kind of pat phrase. Who can, it's like motherhood and apple pie. Who can argue with informed choice? But I hope they'll go away with a lot more questions than answers, really. And that when in their practice, when they're dealing or talking to pregnant women and their partners and their families, they'll take into account some of the nuances of this topic and won't just assume that giving a whole list of information, a whole pile of information to people and handing over responsibility to them to make a choice is enough. I hope that they'll go away with an understanding that this is a far more complex and important area than perhaps they had previously thought.
Well, thank you so much, Sue. This sounds really like a wonderful and very important presentation. I'm really, for my part, looking forward to this. And it was so nice chatting with you today. And again, we're talking about Soo Downe's upcoming presentation, Any Color as Long as It's Rose Tinted, the Meaning of Informed Choice when Women Don't Have Access to Evidence-Based Care Provision. This presentation is part of the GOLD Midwifery online conference series, and it will be held live on February 15 at 1600 UTC. For more information on this presentation and when it's being held in your time zone, please visit www.goldmidwifery.com. Thank you so much for listening, and bye for now.